Hi, this is number 3 in my series of my experiences with having Hep C. The previous one was about when I found out I had Hep C and what that meant to me and my family and my friends. This one will be about the actual treatment that I went through. So at the time when I found out I had Hep C, which was in 2014, the only option that was available was for interferon treatment. And interferon treatment is actually, as a doctor friend of mine says, it's like having your arm amputated to stop an infection. So there's a lot of side effects, and in some countries they're still using interferon. It's not a very effective treatment, and it's potentially fatal treatment. And a lot of people have had really long-term suffering as a result of the interferon treatment, and also not got cured. So nowadays there's a choice, but if anyone suggests that you do interferon, don't do it. There's much better options, much better options. So anyway, I decided I wasn't going to do interferon. I waited around, and eventually generic Sovaldi came available from India, and so my treatment was 12 weeks on Sovaldi, which is the active ingredient is sofosbuvir, plus ribavirin. So I was taking 400 milligrams of sofosbuvir and 1200 milligrams of ribavirin. Nowadays, for genotype 2, you would do sofosbuvir plus decladisvir, which has less side effects and is more effective. But back then there was no generic decladisvir, so I did sofosbuvir plus ribavirin, and obviously cleared it. Now the issue that a lot of people worry about with direct-acting antivirals, which is what sofosbuvir and decladisvir and Harvoni and all those things are, is the issue of side effects, because a lot of people have heard about the terrible side effects from interferon, and they think that there's going to be similar side effects with the direct-acting antivirals. There are side effects. All drugs have side effects, and some people will react worse than others. Like, for example, my wife is allergic to penicillin, so she can't take penicillin. Every drug, there'll be some people who are sensitive to it, and it's the same with sofosbuvir and decladisvir and ledipasvir. Some people will react badly with it, very few in my experience, and some people, it will have no side effects at all. Most people will get some minor side effects. For example, some people get insomnia, some people get slight headache, some people get fatigue. There's all different kinds of minor side effects, and those are listed and easy to discover on the internet. But what I want to say first is that whilst the side effects are there, it's worth it to get rid of the Hep C. Even if you have, like, some people have quite a severe reaction to particularly Harvoni, where it affects them emotionally, they get depression and so on. Usually the side effects will pass in a week or two. Most people I know who've had a severe reaction to treatment have reported that the side effects have lessened or gone away completely within 2 weeks of starting treatment. Some people, they hang around the whole treatment. It varies a huge amount. But I don't know anyone who's actually had such severe side effects that they've actually had to stop treatment. So at the end of the day, it's a lot better than interferon, and it's a lot better than having Hep C. So in my experience, I started sofosbuvir plus ribavirin, and the ribavirin is the drug in that combination that has the worst side effects. I found sofosbuvir, it gave me insomnia. I used to wake up at 1 or 2 in the morning and get up and couldn't get to sleep for a few hours, and then I'd go back to bed and go back to sleep. There was some effects from ribavirin. If you have to take ribavirin, which some people do, because it does, particularly for genotype 3, ribavirin is added to the combination to help get rid of it. Ribavirin has a few side effects which are undesirable. There's a thing called riba rage, where you tend to get a short temper from the ribavirin, and then you get anemia and a few other issues like that. But if a doctor's monitoring your treatment, then it shouldn't be a really big issue. So I started treatment with sofosbuvir and ribavirin, and after about 2 weeks, my liver functions all got back to normal again after being very, very elevated. And at 3 weeks, I had no detectable virus left in my blood. I noticed an improvement straight away. Most people report improving energy levels as soon as the virus is removed from the blood. The liver starts to repair itself, and there's corresponding improvements in health and energy levels. And like, I got an email today from a guy. He started taking generic Epclusa only 3 days ago, and he wrote to me this morning and said, wow, I'm noticing it already. My energy levels are better. I'm feeling healthier. And because in 3 days, certainly in 5 days, it's quite possible that, for all intents and purposes, the Hep C virus is gone from your blood. So your liver will start repairing very, very quickly, and the damage that the Hep C virus has done will be repaired as well. So it's really, really common for people to experience really huge improvements within certainly 2 weeks of starting treatment. The other thing about treatment is that you need to be certain that you don't miss a day. So like, I got a little plastic box, little pill box, 7-day pill box, and I laid out all my doses in that for the week. That way you can't sort of think, oh, did I take my tablets today or not? Because if you got a jar of 28 tablets, you think, oh no, have I taken it or not? So you get your 7-day pill box, you lay out your tablets in that pill box, and you know whether you've taken it or not, because it's really important not to miss a day. If you do miss a day for some reason or other, it's not good, but you can repair it. But if you miss 2 or 3 days, it's a real problem, and you may have to start again. So it's really important to get that pill box happening, and it's also a good idea to take the tablet about the same time of the day, so that you just have this very steady level of the direct-acting antiviral in your bloodstream. Some people, when they're taking this medication, send me an email and they say, oh, I'm really worried about this medication because I'm not getting any side effects at all. And that they notice no change whatsoever. And I mean, that's a good thing. And then they go and get the test, at 2 weeks or 4 weeks or whatever, and they can see in black and white that there's big improvements happening. So when you're starting treatment, I suggest getting a liver function test, which is a relatively cheap test, at about the 2-week mark, because you will actually see really significant improvements in your liver enzymes after 2 weeks, even less. If you can afford it, or if you're in a country where you can get a viral load test cheap, then get one of those too. Quite often the viral load will come back at undetected even after a week. So it's really good if you get some sort of test that confirms in your mind that everything's working. It makes you comfortable with the whole process. If you're in a country where the testing is expensive, like the USA, for example, and it's a real sort of problem to afford to pay for that testing, then you really don't need to get a test, a viral load test, until the treatment's ended. But if you can afford it, it's good to get one at some stage through the treatment, just to give you a bit of peace of mind that the medication's actually working. Well, I think that's about it. The main thing, just to summarise, is that yes, there will be some side effects for some people, no side effects for others, little side effects for some people, big side effects for other people, but the side effects are not as bad as having hepatitis C, and they're not as bad as interferon. Important to be regular with taking the drug, so about the same time every day. Get a pill box. If you get insomnia, the best thing to do is get up and do something rather than lie in bed gnashing your teeth. And at the end of the 12 weeks, get tested, and be sure that you're going to get cured. Have a nice day.